This is a short presentation about living with COVID-19 in calendar 2020. We are experiencing the COVID conundrum. We have many conflicting messages in all aspects of our life that make it difficult for us to decide how we should live our daily lives. We see alarming statistics on a daily basis. The COVID cases are flashed on the news screen. The WHO's website shows that in early May, just a little over a week ago, nearly 1/3 of all cases and over 1/4 of all deaths have been recorded. We see alarming stories that add to our fears. Hourly updates from cities and hotspots, particular patient types, celebrities, mothers, grandmothers, all these stories. The daily reports and the news on the crawl are all different 24/7 messages that add to our fear. These fears may lead to confusion, and as we look at our own life, the nano perspective, our extended groups, families, work places, places of worship, in addition to the macro information, it all can be very overwhelming. At the end of the day, we'd like to feel good about living our lives. We all make decisions every day. Some are easy, some are not. Some are data-driven, some are based on instincts. For most of the decisions, however, we don't have to reveal our motivations, but somehow in today's environment, this feels different. So how can we balance our decision making? What is the nano situation, the micro situation, and the macro situation? If we look at three key areas, health outcomes, health economics, and market economics, we begin to see maybe a clearer picture and maybe some opportunities to help make decisions. In health outcomes, we look at incidence, prevalence, treatments, quality of life. The health economics give us an idea of the costs of treatments, reimbursements to hospitals, out-of-pocket expenses. In the market, we can understand jobs, unemployment, global growth. So let's go back to the WHO information. In the United States, the 20th of March, less than 6% of all the cases and about 2% of worldwide deaths were recorded in the United States. Graphically, in a pie chart, it looks like this. And then about 6 weeks after that, the 3rd of May, we saw nearly 1/3 of all the cases, over 1/4 of all the deaths recorded were from the United States. Now, if we balance this against the United States worldwide population of 4%, these numbers seem drastically higher than what would be expected. We then look at this year's first to try to get an idea of how this information looks to a year in the not so recent past or the last couple of years. And looking at the US information from the CDC, about 8,300 people per day, or about 58,000 per week, pass away. Now, this data is for 2017, 18, and 19. It's the first 16 weeks of the year, and this is an average number of deaths per week. Understanding that the year 2020 was the year of COVID-19, and with WHO numbers in a third or over a quarter of cases, we want to know, what does 2020 look like in that backdrop? So again, here's 2017, 18, 19. Where would 2020 fit in the last 4 years of data? And we see that it's consistent to what 2017 and 19 was. 2018 was higher. So as we look at the WHO and the CDC numbers together, the population, the cases, the deaths, that number for 2020 would appear to have been much higher than what's reported. Also from the CDC databases, we see prior year virus results as shown here back to 2015, where you have illness numbers in the 30 million, 45 million range. You see 2018 as a particularly difficult year related to the influenza outbreak with over 800,000 hospitalizations. And then if you tease out additional information from different types of fatalities during 2018, you see heart disease, cancer, chronic diseases, stroke, Alzheimer's, etc. So as we look at the US numbers and the CDC data, there's a chance that these cases are due to how they are accounted for, how cases are confirmed and coded and reimbursed for hospitals. Just briefly, the ICD-10 code is a classification of diseases, International Classification of Diseases, ICD. This is the 10th version, therefore it replaced ICD-9, and it's used to track healthcare statistics, disease burden, outcomes, and billing. Now there's actually two codes. One is virus identified and virus not identified, 7.1 and 7.2. 7.2 is not identified, so this could be probable or suspected. Now, hospital codes do help determine how hospitals get paid or reimbursed for those services, and this is a deeper explanation from the WHO website of what is a confirmed case and what is a suspected case or a presumed case. Therefore, this helps us to put some context around a country with 4% of the population having a third of the cases and over a quarter of all deaths in a year where the death was just a few years ago. This is a verified report that says hospitals do get paid more for patients diagnosed with COVID or presumed with COVID. And that addition is about a 20% add-on to regular payments. You'll also note in the first bullet that there are 3 times more of a payment if the patients are placed on a ventilator to cover the costs of care of lost business. This also highlights an additional unfortunate shift and condition where most all other healthcare has been shut down because to cover for COVID. Because the unknown demands of COVID were very much unknown in the early stages of the disease, that many procedures have been canceled. Even breast and cervical cancer screenings, colon cancer screenings. And as you can see, heart disease and cancer, about 4 out of every 5 compared to 1 out of every 5 for the COVID-19 patients over a 2-month average. Well, let's look at the 3 sides of every coin. Let's take a look at the COVID side, the all other healthcare side, and the economy. The COVID disease has been a dangerous and devastating condition for many. The health of other conditions have gone untreated or delayed, and a partial shutdown of the economy has been devastating as well. schools, restaurant, travel, entertainment, places of worship, millions of jobs lost, consequences of job losses and loss of social connection, and other issues related to the lockdown are unknown, but they're no less devastating than the actual fatalities directly due to the COVID virus. So we can see that there are increases in suicides and also opioid crises that we need to take into account to balance these three sides of the coin. It leads us to a conclusion that says we cannot manage a heterogeneous situation with a homogeneous structure. We live in a diverse population with different health risks, different areas, regions, counties. We see by two recent studies that over 50% of the counties have recorded no COVID-19 deaths. And about 86% have been less than 10 per county. And this is over a 4-month period. And in terms of who's getting hospitalized, source of admissions, see that home, locking down, staying inside may not be the best strategy. Recently, we've seen some reports that say 96% of the hospitalizations are people with at least one pre-existing condition. And taking care of ourselves is a great way to battle any virus by keeping our immune system strong. So let's listen to a recent interview on this particular subject.
Me though, and as you alluded to, because I wrote an entire book about it, is that America has a chronic illness problem. The biggest predictive factor as to whether someone required hospitalization or not wasn't age. We keep saying, oh, it's the elderly that are vulnerable. Yes, being elderly does make you more vulnerable, but 96% of the people who were hospitalized with COVID-19 on this survey had at least one pre-existing health condition. And when we have about 60% of American adults with one, that's a big problem. And the most common were obesity, cardiovascular disease, and hypertension. And Neil, I hate to tell you, but my book talks all about it. Up to 80% of those cases could have potentially been prevented through lifestyle modifications. And the good news is, it's not too late. You can actually change some lifestyle behaviors right now to lessen your risk of those, lessen the severity of those, and also protect you from COVID-19. Thing that came out of
We also need to ensure that we're getting outside listen to concerning this topic.
We've always known that respiratory viruses tend to die off a little bit towards the warmer, more humid months, and that's largely because respiratory droplets can't travel as far in the air. Also, if you think of increased ventilation, people being outside, windows open, that'll lessen how much of the respiratory viruses are actually circulating around. It's not going to make it go away completely. But the biggest concern that I have right now as we come into the summer months is we have to make sure that we still are getting people outside. We need the vitamin D. We need the social interaction. Our children need the physical activity. So I'm really calling on the private sector and those to figure out how can we reopen, how can we get people outside and do it in a safe manner. We all know at this point how to protect ourselves from the virus. And as we're seeing by the survey in New York, just staying home isn't necessarily working for everyone. So people need to really take that individual accountability of how they're going to protect themselves, their family, while also just trying to reopen the economy, because the economic fallout and the subsequent mental health consequences are legitimate.
So having a holistic understanding of COVID gives us an opportunity to make better decisions. We've acquired vast experience during the past 2 months. The knowledge, the treatments, the testings, and the strategies being utilized are working. Nearly 1,500 clinical trials designed for treatments or vaccines are underway. The majority of fatalities have occurred in about 10% of the U.S. counties. U.S. deaths in 2020 during the first 4 months of the year are in line with expectations from previous years. The vast majority of patients contracting the virus recover, And for ones that do contract the virus now, there are those treatments and the ability to take advantage of the clinical trials that are underway, improving the recovery rates even more. The economy has been open. There are certain parts that have been shuttered, and they are now. So, giving us an opportunity to utilize this understanding to help determine our actions. It has been a dangerous and devastating condition for many. The partial shutdown of the economy and other areas of our healthcare system has been devastating and may have longer lasting repercussions than the COVID virus. At-risk populations, locations that still need special protections, management protocols, actions, and interactions. The healthcare risks of many conditions, not just COVID, will never be driven to zero. And we live in a country that provides us the liberties to live our life and pursue our own versions of happiness while still being respectful and protecting of others. For those that are not in a high-risk category, may live in a county that has a low risk, or are just willing to venture back to their normal, should be given the opportunity to choose how they want to live with COVID-19 in calendar 20. And I have a final wish list. As mentioned, the economy has been open, but some areas, many areas of healthcare have been completely shut down and are just now opening back up. My wish is that we all have the patience to help these areas that have shut down get back up and running. There will be fits and starts. And for those that do want to go to the doctor, they want to get back to work, they want to eat at a restaurant or go to church, it doesn't mean that they want to hurt anyone else. For those that want to keep a distance, let's use the term physical distancing. We can still be friendly, wave or say hi at 6 feet or more. We hope you've enjoyed this opportunity to discuss some of these situations related to living with COVID-19 in calendar 20 and feeling good about the choices that we make. Thank you.